You are talking about the full thyroid panel. Those numbers are so important, and I get this all of the time. I don't need thyroid support. My doctor says my thyroid numbers are normal. And then you ask the second question, what did they test? TSH and T4. And then the second part to that, and by the way, I order my own labs all the time for my family, right online. I use Direct Labs, Quest, whatever. There's so many out there that you can use. But with the thyroid panel numbers, what's normal might not be what you consider to be optimal. So can you actually give us the numbers that people should be looking for, especially, free T3? I always say that is your metabolism. Can you go through the numbers and what is the optimal number range that you should be looking for?
Yes, absolutely. And again, every practitioner is going to be a little bit different. They might differ by 0.2, 0.1, anything like that. These are just kind of general ones that I use. I also, again, take a look at all their other blood work, all their symptoms, right? Like everything that they're presenting with to create a picture. Because like Sara said in the beginning, we are not just a number on a piece of paper, right? We are a human being, and these values usually is what I use. But again, some people, I differ a little bit based off of their symptoms. So for TSH, again, brain to the thyroid, I'm looking for this to be about 0.5 to 2.5. Now, the tricky part that I think sometimes is confusing is if your TSH is high, this can mean hypothyroidism because the brain is having to yell at the thyroid to get it moving. So if you have a high TSH, you're looking at that hypothyroidism, the sluggish thyroid. Moving on to our T4. So for free T4, I like it above a 1 if we could do that. I find that T4 is often hard to hit, and I do think it's because of this lack of iodine that we just have in our system. We need iodine to make our thyroid hormone. If we don't have iodine, we cannot make it. So I do think that I see a lot of people struggle to hit their T4. Total T4, I'm looking around like a 7 or an 8. Again, I find a lot of people struggle to hit that. And then we're looking at our free and total T3. So again, we convert this T4 into our T3. The main area where this is happening is our liver. So if our liver is really overburdened, if we cannot detox, you are going to have a hard time converting. And again, you get your blood work done, your TSH looks great, your T4 looks great, but we have no idea what your T3 looks like, right? And again, this is the one that is talking to the cells. So for 3T3, I would love for that to be above a 3, like 3 to 4.5. For our total T3, I would like it above a 100, like 100 to 140. For our T3 uptake, this is going to be around 28 to 38%. For our reverse T3, around 10 to 15-ish. That one can sometimes be hard to hit. And then, no antibodies would be the numbers for those.
And will you explain to everybody what reverse T3 is?
Yes, good question. So you can actually have something called reverse T3 syndrome. So what reverse T3 is this is the stored form of T3. So we make our T4 mainly from our thyroid. This then gets converted into our T3, and then we store a little bit of that. We kind of have like a little savings account with our reverse T3. If your body is really stressed out, it has no idea what's going on, when am I going to get my energy? Oh my gosh, we are going to store a lot of T3 and we are not going to use a lot. This is where your reverse T3 is very high, and then you can have your T3 that is out in your blood trying to be active very low. So it's called reverse T3 syndrome. I see a lot of blood sugar dysregulation associated with that. And again, right, the body needs to feel safe. The body needs to have good nutrition in order to detox and to use what we have. I see so many women under eating. I did this all the time, under eating, overtraining, and I had no idea that I was really putting my body into this starvation mode. I was causing my thyroid to slow down even more because when you're in this starvation mode, your body wants to conserve everything. And so you can see that reverse T3, that savings account increasing.
Yeah, and when I was having that complete attack of the parasitic infection and my liver was backed up, my reverse T3 was through the roof. And it was no surprise because my body was under threat and it was going after survival. Hair was falling out. Why? Because my body doesn't care about my hair. It's going to take care of everything else. So these are the signs that you want to look out for, to know that, hey, there's something deep